Dietitians are allocated the job of providing expert nutritional and dietary advice for people with many different health-related concerns. They can help people recognize the relationship between food and their healthy or unhealthy lifestyle choices. A dietitian in Australia is qualified to work in many different clinical and non-clinical settings, including public health, teaching roles, as well as being located in medical centres, hospitals, and private medical practices. Not only do dietitians help assist healthy individuals in maintaining their desired lifestyle, they also assist people with a variety of medical conditions in hopes to maintain and lessen the impact of such conditions. Accredited practicing dietitians are also knowledgeable in the field of public health and are able to influence populations through an impact towards food policy and government-related public health positions. Dietitians rely heavily on clear communication, people skills, and adapt knowledge of biological sciences, such as anatomy and physiology, as well as knowledge of nutritional sciences and chemical biochemical understanding. These skills help dietitians to be effective in the management and evaluation of their clients.
When starting a career in dietetics, a minimum of 4 years at an accredited university must be completed. The university degrees to pursue within South Australia include a Bachelor of Food Nutrition and Science, UniSA, a double degree of Bachelor of Human Movement / Bachelor of Food Nutrition and Science, again UniSA, and a Bachelor of Nutrition and Dietetics at Flinders University, to name a few. During the university accreditation, a minimum of 20 weeks placement must also be completed, and throughout this placement, students must meet national competency guidelines. Once the degree is completed, the recently graduating students must register in the Dietetics Association of Australia, DAA, to be able to become an accredited practicing dietitian. Throughout a dietitian's career, they must follow the DAA Code of Professional Conduct and Statement of Ethical Practice and accomplish audit requirements. They also must complete a minimum of 30 hours per year of continuing professional development.
Dietitians are predominantly split into 4 categories of work that include hospital, corporate, sports, and private practices. Hospital, corporate, and private practice settings include individual consultations for those who need to change their diet and eating behaviours to a healthier lifestyle. The work hours for these types of careers would mostly follow 8:30 a.m. to 5 p.m. on weekdays. However, a different area of dietetics would be within a sporting environment. The work that sports dietitians would follow will fluctuate depending on the season, time of games and trainings, and sometimes involve travel. Sportsmen and women, sportswomen, and teams need adequate fuel, hydration, and supplements to compete in a high-performance sport.
Privately practicing dietitians may charge their clientele anywhere between $50 and $150 in Australia for initial consultation. In 2018, statistics found that full-time employed dietitians in Australia were able to earn an approximate average of $1,426 per week, the equivalent of $74,000 per year. Depending on individual and requirements relating to this career, employment prospects generally involve full-time positions. However, part-time roles are known to be available. In regard to working hours, it depends on the setting of their practice, whether clinical, non-clinical, etc. But typically for a full-time dietitian, their working hours consist of an average of 40 hours per week, with the occasional requirement of weekend work. Examples of real-time employees based in Adelaide include SportsMed Australia, Pro Nutrition SA, Adelaide-based dietetic practice, and Core Nutrition Adelaide.